Dear colleagues, I'm pleased to address you on the EU's engagement in public health in the Western Balkans, the Eastern Partnership and Southern Neighbourhood today. Although I'm speaking remotely now due to other commitments, I'm glad that so many distinguished health experts and stakeholders could come together in person and discuss this topical issue in the field of public health. As you know, public health is an emerging positive area of cooperation between the EU and Israel. And I'm convinced that it will open up new opportunities in other related fields, including with the WHO. It is a particular pleasure to note that the annual session of the WHO Regional Committee for Europe takes place in Tel Aviv. I would also like to express our appreciation for the WHO for our productive cooperation, in particular in the Eastern Partnership and the Western Balkan countries. As you know, during the COVID-19 pandemic and after Russia's invasion, our partnership has literally saved lives in Eastern Europe. At the outset of the pandemic, back in early 2020, we quickly teamed up to address immediate health emergency needs, delivering life-saving medical equipment and demonstrating European solidarity in all three regions. In early 2021, we started with the WHO another major regional program worth 40 million euros that contributes to broader health resilience and ensures readiness for the efficient rollout of safe and effective COVID-19 vaccines. This program is the most extensive EU-WHO joint program ever implemented in WHO's European region, a clear sign of our effective and robust partnership. Let me also mention that the European Commission signed an innovative agreement worth 35 million euros with Poland to support EU member states in the delivery of COVID-19 vaccines to the Eastern Partnership countries. These projects have provided much-needed relief not only in the first days of the pandemic, but have also contributed to building more substantial and more resilient healthcare systems capable of withstanding future cross-border health threats. Our cooperation is productive and fits good into the evolving public health circumstances. For instance, we have secured critical medical supplies, provided vaccination for Ukrainian refugees in Moldova, or offered psychological support to Ukrainians affected by the invasion. In the context of Russia's aggression, we could immediately reallocate some of the funds to provide emergency health support. Our engagement in the Western Balkans is equally fruitful. WHO continues to play a central role in monitoring COVID-19 vaccine distribution via our funding to the WHO. In response to COVID-19, we have mobilized 3.3 billion euros in medical and socio-economic support to the Western Balkans and 9 billion euros from the EU's Western Balkan Economic and Investment Plan. We provided 70 million euros of grants for vaccine purchases, which enabled us to give almost 1 million vaccines with the help of Austria and Portugal. We have donated over 5.2 million vaccine doses to the Western Balkans, including over 400,000 via COVAX. More are potentially in the pipeline. Since future pandemics are inevitable, ensuring well-functioning public health services in the region is essential. In this context, the European Commission shares many of the objectives of the WHO roadmap for health in the Western Balkans, particularly when it comes to closing the health gap with the EU. As you know, the core of the EU's economic and investment plan is to ensure real integration with the EU and to strengthen the region's resilience to the benefit of the people, including in the field of public health. One of the best examples of this work is the construction of a new children's hospital in Belgrade. The European Union has never supported such a big healthcare infrastructure project in the country. Dear ladies and gentlemen, We remain committed to delivering for the Western Balkans and the Eastern Partnership countries, and we count on the continued excellent cooperation with the WHO. Thank you for your attention.